So here we have this question that burns may be superficial, deep burns or chemical burns, right? So what emergency care would you suggest in each case? So let's discuss, right? So here we have this answer that burns can be classified into three categories, right? First one is the first degree burns, or we can say the superficial burns. So they affect only the top layer of the skin, right? So in this like that skin is not that much affected, right? The second degree burns, or we can say medium burns, they damage the deeper layers of the skin, and it also causes the blisters, right? And the third is third degree burns. So what is, they reach up to the deepest layer of the skin, and the skin may have the charred appearance. So what is charred appearance? That means it looks like burnt black by fire, right? And the third is, in case of the first and the second burns, what we can do, we should place the burnt part immediately in cold water or put some ice cubes on it, because it reduces the burning sensation and formation of blisters, right? And even blot the affected area and apply haldi, or we can say that is the turmeric powder or mehendi, right? So it also provides the cooling effect on that burning place. Even you can also apply the, like, we can say the toothpaste. Okay, toothpaste is also very much beneficial for this thing, right? And even apply a soothing cream like the Bernol. So what is Bernol? Bernol is an antiseptic germ control cream, and it is also used for the burns also, right? The next point is, in the case of the third degree burns, so what we can do in the case of third degree burns, we should never use water, right? So what we should do, that we should apply the Bernol on spot, and then some other ointment, and suddenly wrap the wound with a clean sheet and or towel, and we should rush to the doctor or burn department of the hospital, right? Because third degree burn is very much dangerous, so we should directly rush to the hospital, so that we should get the better treatment, right? So the next is the chemical burns. So chemical burns can be the acid attack, or some, like if acid has if you are like suddenly the acid fell on your skin. So what you can do, you can, it should be washed, that acid should be washed immediately with a large amount of cold water for at least 10 minutes. So continuously you have to wash that acid, so that its effect should be totally removed from the skin. So at least you should wash it for 10 minutes, and you can take you can increase the time, but the minimum time should be 10 minutes, right? So then you can remove the clothes from the burn area and cover the burn with the sterile dressing. So what is sterile dressing? So it is used to control bleeding from a major wound, or to absorb any discharge from a minor wound, right? So I hope now you have understood each and everything. Thank you so much.